Hello, everybody. I am a orthopedic surgeon specializing in sports medicine, and just here today um, to go over any sports medicine questions. I do this weekly and try to answer as many questions as possible and um, get any interest to your sports injuries that you may have, and try to give you some knowledge about what I do. So I'm a sports medicine orthopedic surgeon. I specialize in arthroscopic and open procedures of the shoulder, hip, and knee. I help a lot of um, I help a lot of um, people get better. Maddie, thank you for joining. We're just waiting for some people to come in here, and appreciate your comments. But we're going to get started in a few minutes, in like a minute or so. If you have any comments or questions about sports medicine injuries of the shoulder, hip, and knee, I'll be happy to answer them. And any questions that I don't answer, I'll be sure to try to answer them in a DM or a comment somewhere down the line. And just send me your questions. I can tell you just today, I finished up operating. I did a couple cases. I did a shoulder rotator cuff repair and a ACL repair for a injured ACL. So I am going to start answering any questions that you have. So first question I have is from Tristan. What should I do with my IT band? It's been really bugging me. So the IT band is a band of tissue that surrounds your hip, goes from basically your pelvis or your buttocks area. It goes down to the knee and can get very tight with a lot of activities and sports. Runners get this very often. Many times it gets better with rolling it out on a foam roller or some stretches, and that usually helps it and takes that pain away. Thank you for the question. Carter G says, "What's up, med device rep here? Any tips?" My tip for med rep devices, med rep folks, is to really just know your products and know the surgeon you work with, because we really rely a lot on these med reps, and they perform a very good service for us and their patients. So question we have here from Lily says, is it normal to be able to walk on a completely torn ACL? So that's a great question. ACLs, once you tear your ACL, it actually isn't very painful. The ACL is the primary stabilizer of the knee, but it is not necessarily a pain generator. So if you tear your ACL, you may not have pain after the initial injury, and you may be able to walk fine. But the problem is, if you do a lot of cutting and pivoting sports, that ACL is not going to allow you to do that if it's torn. So Lico says, I got hurt and injured my quad from track and still have a little pain in the area today. So quad tendon or quad injuries are very common in sprinting. It is very common, but it can get improved with physical therapy, stretching, and strengthening of the area. The main thing you want to avoid, and obviously you want to be careful of, is a quad tendon rupture. And those are very serious injuries that require surgery. But if you have a quad tendon rupture, you will not be able to run or really walk or anything like that. Ricky, trying to go through some questions here. There was a question about rotator cuff. Sorry. So Ricky Stinger says 50% tear in my rotator cuff. Can I get better without surgery? So that's a great question. So the rotator cuff is a group of muscles that surround the shoulder, allow you to raise the arm up through a mechanism that basically gives you a mechanical advantage when you raise your arm and raise your shoulder. And you can have a partial tear of the rotator cuff. So that means that if you have multiple layers of the rotator cuff, if you think of it that way, 50% tear is obviously half of the rotator cuff is compromised. And many times you can do physical therapy to see if you can get better. But for people who don't get better with physical therapy, I found that doing a rotator cuff repair is the option that works best. But sometimes people can get by with physical therapy alone. So Gingerbread Man says, I have a medial meniscus tear. Do you need surgery? So again, for people with meniscus tears, you can try physical therapy. It depends on the tear. And I usually determine what therapy or what treatment works best based on the MRI. If there's a severe tear, sometimes physical therapy is not indicated because the knee will not have the correct mechanics unless you fix the meniscus. But for some meniscus tears are chronic, and many of those can respond well to physical therapy. DB says, ACL surgery in 11 days. How bad am I going to be hurting? I got to be honest, for most of my patients that I operate on, really the first few days are a little bit challenging, but it's not terrible. The pain is not challenging in terms of severe pain. It is more sore and difficulty moving around for the first 3 days, but I see them 7 days after surgery and they're doing very well for the most part. Bridget says, if I have bilateral stress fractures in my shins, is there a way to speed up the recovery? Stress fractures in shins are very common in runners, especially female runners, because sometimes hormonal imbalance can cause shin splints and weak bone. And in high distance runners, shin splints are a very big problem. And what I recommend for the runners that I see is to obviously stop running long distances and take your time and really focus on a calcium vitamin D regimen that can improve some of the bone quality, but it takes time, at least 6 weeks or so. So Marco Nunez, thank you for your question. He said, thoughts on utilizing rehabilitation instead of physical therapy? I've had patients come to me when they don't get positive results in physical therapy. And so I think the semantics here between physical therapy and rehabilitation, and it's different in terms of how people use the term. I think physical therapy is more for people, in my opinion, who have a injury that they're trying to acutely recover from. So after surgery, you do physical therapy. After a acute injury, you do physical therapy to get better from that initial injury or that initial surgery. Once you recover from that initial injury, I think if you do rehabilitation and trying to basically get yourself back to where you were before, that's a little bit different than physical therapy. So rehabilitation aims at getting you back to your level, whether that's your level of sport or your level of activity. So thank you for the question. So the boy says, why does a torn ACL take forever to heal? So the ACL, when you do surgery for ACL surgery, it can take up to 9 months to recover because it takes time for the actual reconstructed ligament to basically turn into a new ligament inside the knee. And that process takes 9 months because that's a biologic process that happens inside of the inside of the knee. And in addition to that, when you have the surgery, you lose a lot of muscle strength and coordination, and the whole physical therapy is aimed at trying to get your strength back and your dynamic stability. So that takes a long time. It's not just a overnight process. So that's why it takes such a long time. So Dana says, Doc, how can I avoid arthritis after ankle fracture dislocation? So an ankle fracture dislocation is obviously a very severe injury, and the injury alone, unfortunately, causes the majority of the damage to the ankle. And so the best way to avoid it is to maintain a relatively healthy lifestyle if you can. Obviously, you don't want to do a lot of heavy, high impact activities. But if you try to stay healthy, try to maintain a healthy weight, that's the best chance that you get. But unfortunately, the injury and the risk of arthritis happens at the time of injury. MH Matters 26 says, I just had another hip surgery after tearing my labrum. Hopefully you get better, but hip labrum surgery is very successful for most people. Big Moose on Instagram says, treatment for bone spur in the heel of the foot. So bone spurs, I'm not a foot surgeon, so I'm not going to necessarily go into complete detail on this, but usually for bone spurs, they can, depends on where they are, they can do a procedure to get rid of the spur, but typically that's physical therapy to get better. Marco Nunez, thanks for good seeing you too. So Marco Nunez is on Instagram right now. We used to work on the Lakers together when he was an athletic trainer there. He's definitely one of the best in the business. So guys, go follow Marco Nunez for great rehab and PT tips from a great trainer. Thank you for that. So I'm going to go to other questions. So again, if I miss your question, just send me a DM or a comment somewhere else, because I have to skip around. There's a lot of questions here. So Lily says, I tore my ACL, I have a fracture in my tibia. How does that happen? So the tibia fracture is actually, it depends on the tibia fracture, but many times the tibia has a stress fracture because of the impact that happens during the ACL injury, because the knee actually pivots and shifts, and it causes a very big impact onto the bones in the knee, and that can cause a stress fracture in the knee. It's not a very serious fracture. It heals on its own. It's not necessary to treat that fracture separately from the actual ACL surgery. Christian Van Epp said, I tore PCL and LCL. What's the recovery time? PCL, and really the PCL recovery time for surgery is typically 6 to 9 months, similar to the ACL basically. And that's the combined surgery is about the same, 9 months. So Jay says, grade 3 AC tear, non-surgical, but some weakness, stamina in my arm. Should I go back to PT? So grade 3 AC sprain is basically a shoulder separation. And many times we can treat that without surgery, and physical therapy usually gets better. So if you feel weakness in the arm, it is worthwhile, in my opinion, for my patients to go back to physical therapy. But in general, if you feel like you have not been progressing well with the surgeon treatment, I would usually recommend seeing your treating physician to see if there's something else that might be the reason for your lack of progress. So on Instagram, Carolina B says, I felt a pop in the back of my knee. Can't fully extend. Calf and knee feel tight. I mean, I cannot, unfortunately, give you a diagnosis over the internet like this, but people can injure muscles. Usually pain in the back of the knees from an injury related to a muscle, but I can't necessarily give you a definitive diagnosis on the Instagram like this. So I'm going to skip around. Sorry if I missed your question. Send me a DM. So Chuck says, I got pain under my kneecap when I run and jump. What should I do? So that's a very common complaint that is known as runner's knee or patellofemoral syndrome, which is the medical terminology for it. And that improves with physical therapy aimed at quad strengthening and hamstring stretching. Hudson Bilodeau says, Arthrex rep here, opinion on LET versus ALL. So that's a great question. The LET is a lateral articular tenodesis, and the ALL is the anterolateral ligament. And these are both structures that are supportive structures in the knee, especially with ACL reconstruction. I routinely perform an LET or lateral extra-articular tenodesis in my ACL reconstruction surgeries in high-level athletes and young individuals. So PJ says, is there any reason why there is more Tommy John surgeries performed in baseball now? So that's a great question. So Tommy John surgery is a surgery that is performed typically on pitchers or high-level throwers, and that is due to a ligament that gets injured in the medial aspect of the elbow. And the reason why a lot of times a lot of pitchers now are having it, in my opinion, might be because, one, a lot of pitchers are throwing harder and faster earlier in their career. So they're doing it in high school. They're doing it in even in middle school. You look at the Little League World Series right now. These baseball players are getting better and better earlier and earlier and playing harder and harder and throwing harder. But also in the major league, now that we have a pitch clock, pitchers are having higher pitch counts because they have to throw more frequently. So that might be leading to some of the increase in the Tommy John surgery because of the overuse injuries are increasing here. So Noble 22 says, my dad ruptured his quad tendon completely and had surgery yesterday. What is the recovery time? So hopefully he feels better, but quad tendon recovery time typically is at least 6 months getting back to activities. Usually for the first 6 weeks, you're limited in terms of your range of motion and walking, and it progresses from there. But 6 weeks is usually the time where most of my patients get back to doing, somewhat high level activities. So Carolina B again in Instagram says, what I recommend to get a diagnosis. I recommend going to a orthopedic surgeon to get your leg checked out. Hopefully you feel better. So Caesar says, going into my third ACL and meniscus surgery, my left knee, I'm only 19. Should I retire or play? That is tough. I'm sorry about all those ACL injuries. It depends on kind of what your goals are, but I would say if you want to continue playing whatever sport you play, you should keep going and try to get your knee fixed to the point where you can play your desired sport. But I would say for someone who has had multiple ACL tears, it is worth getting possibly a second opinion, or at least going to a surgeon who does a lot of revisions, because many times people who have a lot of ACL tears on that same knee, they might have other structures that are necessarily not normal that need to be evaluated, such as the slope of the knee or meniscus problems that might need a meniscus transplant, or the alignment of the knee, basically. So there might be very subtle signs that might be leading someone to have more ACL tears that, if it is not closely looked at by an expert, it can continue to be detrimental for your recovery and cause more recurrent ACL tears. So Cade Meadow says, ACL with internal brace and backfilling the tunnels. That's a great question. So that's a very specific question related to ACL reconstruction. And I perform my ACLs routinely and pretty much 100%. I use internal brace, which is a technique that uses a strong suture to basically add to the ACL by giving it more stability, or it takes away some of the tension in the ACL as it heals. And I don't necessarily backfill the tunnels. I've done that at times, and I think that there is a place for that, and I might do that more routinely as I look at the data on that. So again, if I missed your question, send me a DM, please. So Perfectly Tennessee says, how do you know when you have a fractured or sprained ankle? I would say you do not know definitively until you get an x-ray. So if there's a question of whether or not your knee is fractured, your ankle is fractured or sprained, I would go and get an x-ray. I would routinely have athletes who injure their ankle, and we get x-rays on everybody just to make sure, because sometimes you never know, especially with the ankle. So Allie says, I tore my meniscus in April. PT since hasn't gotten better. Surgery is recommended now or move forward. So if I have someone who has a meniscus tear, I determine how bad the meniscus tear is. If it is a severe tear, then I usually recommend surgery. If it is not a severe tear and it's been somewhat chronic, I would send them to physical therapy. If they don't get better with physical therapy, the next progression is to get surgery. That's what I tell my patients routinely, and it works out well. So I'm going to skip around here. So Real Hoops 3 says, I hurt my shoulder playing football years ago, never got an MRI or diagnosis, can't reach my arm straight up, weak still. So I think you kind of answered your own question there. You should see an orthopedic surgeon, first of all. I would say if you still have issues with your shoulder years ago and you can't really reach straight up and have pain with it, you should get an x-ray and possibly an MRI if it warrants it, but that should get looked at. User some long number says, I was doing shoulder press and thought I strained my neck, but now I'm having pain in my arm. Hard for me to say. I'm not going to make any diagnosis on social media, but neck pain or neck issues can cause pain in your arm if you have a pinched nerve. So Ty Jones says, thoughts on the Bear ACL. So Bear ACL stands for Bridge Enhanced ACL Repair. And that is a technique that is becoming more and more common to basically augment a ACL that is damaged, but you don't need to reconstruct the whole thing. And it has very promising research in very specialized cases. And I do think that it does have a place in certain individuals. I would not personally do it in high competitive athletes at this time because the data shows that there is a higher re-tear rate possibly in these individuals. So it still remains to be seen the perfect candidates for these. So I have about 5 minutes here, guys. So hopefully we can get some more questions answered. If I don't get your question answered, you can send me a DM. So Mosey21 says, my knee is doing A1 when, oh, sorry, that's my patient. Okay, glad you're doing well. Sorry. Thanks for tuning in too. So I'm keeping these questions to at least what I'm answering is shoulder, hip, and knee, because that's my specialty. If you have back pain and other things, I can't answer your questions right now. So Billy2034 says, swollen knee with popping sound when I walk. Hard to say. I'm not going to give you a diagnosis right now. But anytime you have a swollen knee, catching, locking, popping, things like that, you should see an orthopedic surgeon because your knee doesn't get swollen without reason. A swelling in the knee is evidence that there's something inside the joint that is abnormal. So I always recommend seeing an orthopedic surgeon if the swelling doesn't get better and it causes severe functional limitations. So Mikey Simon says, what does recovery time look like for an MPFL? I've dislocated my patella, I'm going to say 3 times. So the MPFL stands for medial patellofemoral ligament, and that's the main ligament that stabilizes the patella or the kneecap. And it can get and your kneecap can dislocate if you have damage to that ligament. Usually the recovery time for that is about 6 months in terms of going back to jogging in some sports, and then maybe 6 to 9 months if you are going to be a high level athlete. So so Gage Wilson says, patella tendonitis won't heal after 3 weeks of PT. What should I do? So typically PT is a 6-week process. So I know it is difficult to do and get through a whole 6-week process of physical therapy, but usually 6 weeks is required to really know whether or not you're getting better or not. In terms of patella tendonitis that doesn't get better in general with physical therapy, the usual thing that I tell patients in that case, which is very rare, is that an arthroscopic procedure can help to clear out any damaged tissue, but usually physical therapy gets patella tendonitis improved. So I would usually question whether or not the physical therapy is adequate if it's not getting better. Stargaze 7884, good to see you as a pharmacist. Thank you for tuning in. So C says, I had ACL surgery about 3 years ago. I used a quad graft. A bump appears in my quad when I flex my knee. So I cannot give you an exact diagnosis, obviously, on the internet like this. As I say every time, I cannot give diagnosis on this, but sometimes the quad tendon, when you use it to reconstruct the ACL, when you repair it, sometimes there's a lot of suture that can cause some irritation to the skin. So if there's an issue with the ACL graft site, or sorry, the ACL harvest site, I would urge you to see your orthopedic surgeon to get it checked out to find out what the issue could be. So I have about 2 more minutes left here. So Levi Lawrence says, I have athletic pubalgia, but nothing is showing up on the MRI. Next steps. So athletic pubalgia is basically what they call sports hernia. And a sports hernia is where the rectus, some of the rectus covering, it's called the aponeurosis, or the fascia around the rectus, get irritated as it inserts onto your pubis, basically your pelvis. And a lot of soccer players or hockey players can get this injury because it happens with some leg extension or hip extension when you do kicking or and other motions of the hip and lower extremity. Typically, it can show up on MRI. So if there is no real finding on MRI, it might be possible that there is a alternate diagnosis that has not been necessarily found. So typically, it does show up on MRI. So it can be confused with hip pain and some other issues as well. And so I'm going to take one more question. Sorry, I have to go. I have another meeting right now. Ellis says, I tore my ACL, MCL, and meniscus, my MCL again 4 months ago, and MCL again. So it sounds like a multi-ligament injury. In general, if you have multi-ligament injury and continue to have instability, I usually recommend some kind of fixation, because you cannot usually have a good functional outcome if you do have significant ligamentous injuries. And so I'm going to answer this last question. I have to go. So Patrick Johnson says, can you speak on the rareness, uniqueness of the Latarjet surgery? So the Latarjet surgery is a stabilizing procedure to the shoulder it's usually for bone defects in the shoulder joint. But it can occur with people who have a very high risk for dislocations. And I wouldn't say it's a necessarily rare surgery. It is more common in Europe and overseas, actually, than in the US. So it's not a very rare surgery, especially in Europe. But for the right indications, it's a very good surgery and works very well. But I would caution you in thinking that it's a very rare surgery. It may not be the first surgery that a lot of people get for a shoulder dislocation, but it definitely is a procedure that is commonly done for high risk athletes who have dislocation events that occur a lot and have bone defects in their shoulder. So I'm going to have to get going. But again, I appreciate everyone who tuned in today. I try to do this weekly to answer your questions about sports. And again, I'm very sorry for any questions I did not get to. If you have any burning questions that I did not answer, feel free to send me a DM or comment, and I'll be sure to try to get to you as soon as possible. Again, thanks for joining and tuning in. And my name is Philip Williams, and hope to see you another time. Take care.